Good afternoon. My name is Sarah Weiner, Program Manager of Education and Practice at the Association of Schools and Programs of Public Health. Thank you for joining us for today's ASPPH Presents webinar, Reaching Beyond Our Students, Recruit, Educate, and Engage. Today's webinar will be 1 hour in length. We will begin with a short introduction of our presenters, followed by 3 presentations, each accompanied by a short question and answer period. This webinar is part of the 2017 ASPPH Presents monthly series. The webinar is being recorded and it will be available on the ASPPH website in the archived webinar section soon. Additionally, this webinar has been approved for 1 hour of CPH continuing education credit. A few housekeeping items of note. While you are in listen-only mode and your lines have been muted, we encourage you to ask questions throughout the presentation by using the question box. We will address your questions at the end of each presentation. We are pleased to have with us today our speakers, Beth Canfield-Simbro, Keri Griffin, Susan Simmons, and Sarah Cady. The first presentation, Public Health Stealth, including public health concepts in a general capstone class, will be given by Dr. Beth Canfield-Simbro, who is an Associate Professor of Public Health and Health Education at the University of Mount Union. She received her PhD and MPH in Public Health from The Ohio State University and her BS in Biology from Wright State University. The next presentation, Creation, Implementation, and Evaluation of an Undergraduate Public Health Summer Program for High School Students at a Health Sciences University, will be given by Dr. Keri Griffin, who currently serves as the Director of the Bachelor of Science in Public Health Program and an Assistant Professor of Public Health at MCPHS University, formerly known as the Massachusetts College of Pharmacy and Health Sciences. After obtaining her Master of Public Health degree in epidemiology and working at Georgia's District 4 Public Health Services, Keri completed the W.K. Kellogg Fellowship for Emerging Leaders in Public Health at the University of North Carolina at Chapel Hill Schools of Public Health and Business. She later earned her PhD in Public Health with a concentration in Health Education and Health Promotion from the University of Alabama at Birmingham School of Public Health. Our third and final presentation, a focused approach to on-campus recruitment through career communities, will be given by Susan Simmons and Sarah Cady. Susan Simmons is the Director of Career Services and Student Engagement at the Indiana University School of Public Health, Bloomington. Dr. Simmons manages career services across 5 departments, facilitating the career planning process for undergraduates, graduate students, as well as alumni. She has served on a university-wide Career Services Council for the past 11 years and is a founding member of the Campus Metrics Committee to track career outcomes data at IU. Susan has extensive experience in internship coordination and career coaching, as well as certification in MBTI assessment and interpretation. Sarah Cady is an employer relations professional at Indiana University Bloomington. She currently is the Associate Director of Employer Relations, representing the media school within the College of Arts and Sciences. Prior to this role, she was the Associate Director of Employer Relations within the Office of Career Services at the Indiana University School of Public Health, Bloomington. She works with employers to identify recruitment needs and facilitates connections through networking events, career fairs, and employer site visits. Thank you for being here today, Beth, Keri, Susan, and Sarah, and I am going to turn it over to our first presenter, Beth Canfield-Simbro.
Good afternoon, everyone. Today I'll be talking a little bit about what I call public health stealth, or how we can incorporate public health concepts into classes that aren't necessarily for our majors and for our minors. Whoops. All right, so I want to tell you a little bit about what I've been doing, and then at the end I would love to hear what you are doing or are thinking about doing in terms of incorporating public health into some of your general education classes. I'm assuming we're all familiar with the Institute of Medicine study, but a long time ago it was suggested that every single student in an undergraduate program in this country have access to public health content. That's not always possible at some small schools, at schools maybe without someone who is sort of like us, a public health professional. So I am in the position of having a public health major and a public health minor, as well as a health education major. So I also teach teachers who will be going out and teaching health in mostly middle schools and high school. So as I said, I have a public health major and a public health minor. However, we went through sort of a university-wide downsizing, I guess I'll call it, about 2 years ago. and I have 3 more years of the public health major and minor until it's rolled out and it's gone. Maybe it will come back. I'm certainly hoping it will come back, but although I do teach school health teachers and I love that, I am obviously very much pushing community partnerships and things on my school health teachers, just because that's who I am and what I love to do. But I will admit I was really sad when it was determined that the public health major and minor was being downsized and cut. So I thought, oh my goodness, and I moaned and I sulked. But eventually I kind of got myself together and picked myself up and said, okay, well, if I can't have a major and I can't have a minor, electives, yeah, that could be fun. I may well be teaching an epidemiology class as an elective. I think it's required for some people who maybe want to go to veterinary school. So I've been working with the biology department to offer that. But how can I reach a lot more folks than I would through maybe an elective type class? And so we also, a few years ago, went through getting a new general education system, which was super fun for no one. But we used to have kind of a distributive model where they had all kinds of different categories and students would take one class in each category. None of them were super public health friendly. Our new model is a bit more integrated, and I saw some opportunities where I thought, okay, I can do something with some of these classes. So the rest of my talk isn't going to make much sense unless you have some idea what our general education curriculum is like. So I'll take a minute to kind of walk you through what we have every single student at our university do. We have one first-year seminar, and that is partly content, and I'll share with you some of the public health related type courses that are for our freshmen in a few minutes. But it's also sort of how to write, how to research, how to have oral presentations, how to be a successful freshman. There's a lot in there. After that, students can take their 4 foundation classes. So there's one from each category: arts, humanities, natural sciences, and social sciences. So many students wind up taking far more than just 4, but 4 is what we require. There are a few of those that I would say have public health content, and again, I'll talk about those more in a few minutes. We have themes classes that are mostly for juniors, although some people will take them as seniors, some as sophomores. And we have different kinds of, we call them clusters. So there are lots of different choices. The one I teach in is called the wellness cluster. And obviously it is completely ripe for all kinds of public health concepts. And then the main focus of my talk will be the Capstone class, which is meant to be kind of the culminating class of our whole general education curriculum that's typically taken during the senior year. All right, so some of our first-year seminar titles, I will say I have some wonderfully creative colleagues who maybe are not public health trained, but do a lot more public health in their classes than I ever thought they did. So we have some titles here: Freshman 15, Reality or Myth, from Breaking Bad to Ebola, Science is Sexy, Ultra, Ordinary People Doing Extraordinary Things. I didn't really know what ultra is. It's, I guess, a very long marathon or triathlon. I have a friend in psychology who has become super fit and does these ultra marathons and really enjoys studying people who can do those sorts of things. One of my other friends in psychology teaches demons and diagnoses, and his class is a lot of fun, especially if you like horror movies. And then jump off a cliff, latest health fad or educated choice. So we could talk about maybe some of the various different YouTube challenges that I know my students have to talk to their high school, middle school students and high school seniors, why we don't smoke Smarties, for example, why you shouldn't stuff your face with marshmallows, all those fun kinds of things. In terms of foundations, Introduction to Sociology is a requirement for the public health major. Be the Change, Introduction to Public Service, Introduction to Gender Studies, World Politics, the Psychological Sciences, and Introduction to Environmental Science. So again, public health doesn't fit well into a foundation, but there's certainly ways to sneak in a lot of public health content in some of these classes. In terms of themes, students take 2 classes. These are only a few from the wellness theme. It's one of the larger themes. And they take 2 classes, and then at the end they write a reflective paper sort of tying together, for example, health communications and health economics, and talking about the similarities, the differences, how it sort of helped change their lives. You can see the one that I teach is Principles of Health Behavior and Health Education, and kind of the key question is, why do people make unhealthy choices? What are some of the good reasons? How can we help people make healthier choices? And then capstones, I like teaching my capstone. Mine is the very last one called Systems Thinking. But by senior year, the students are so ready to graduate. They are really focused on their major classes, getting internships, applying for jobs, applying for grad school. And that's been one of my biggest challenges, was really trying to engage them. But this is a list of a lot of other classes that I think are A, very popular, and B, you can really work some public health concepts into very easily. Global health is being developed right now as a capstone by a nursing professor, and I am so sneaking in and teaching that during the 2018-19 academic year. I can't wait. But I do like my systems thinking class quite a bit. It was actually developed by a colleague who is in environmental science. And so he teaches it slightly differently than I do, and that is totally okay. I didn't even know what systems thinking really was before I said, oh, that sounds interesting. I'll teach that. I want to learn something new. So systems thinking is just a way of thinking about an entire system. So a system is really an interconnected set of elements that achieve some sort of purpose or serve some sort of function. So we have so many systems in public health, it's ridiculous. I can't even talk about all of them. A few are on this slide. I tend to focus a lot on environmental sustainability, but I also talk a lot about the healthcare system, the education system, personal systems like family, peers, corporate systems. We talk about a lot of different things. This is my textbook, one of them that I really, really like. It talks a lot about not just environmental sustainability, but about interpersonal relationships. It talks about peace, justice, racism, kind of lifespan development, morality. There's a lot in there that I really enjoy, and it is very engaging for students. So in terms of some of the public health systems and concepts I talk about, we talk a lot about poverty. That we could spend an entire semester just talking about poverty. The same with food insecurity. And of course, those two go together. I tend to have lots of education majors in my classes, so we talk about how education is a system. It's kind of at the root and the core of a lot of those: poverty, not having enough food, environmental sustainability, and then our healthcare. These are things we can't put Band-Aids on and just say, okay, slap, we've made this one change, without thinking about all of the unintended consequences of making those changes. So I've been listening to and paying attention to what's happening with the Affordable Health Care Act and just thinking, oh my goodness, let's think about some of the consequences about what's going on with this. So I've really become more of a systems thinker than I ever thought was possible. And I've really had a lot of fun doing the general education curriculum classes. It's really neat for me to have lots of different majors, and so I've learned a lot in my capstone classes. I just am very upfront with the students and say, you know more about your major than I do, unless you're a public health major, in which case I still know more than you, but I will treat you more as an equal in this class. And so I've learned so much about technology, corporate wellness. Students in the class do an infographic about one of the systems that's kind of related to their major. So again, I learn, they teach me, I teach them. And then they do a final group project, and the group projects, everyone in the group has a different major. If I can make it work, they all have different minors too, but that gets a little bit trickier. And then they choose a big problem. So some sort of wicked problem that we can't just slap a Band-Aid on and make better, but what really can we do to improve it? Because we talk about improving things and how important it is for lots of different people with different knowledge to work together to solve some of these big problems. I would love to say that public health could solve all of these. I don't think we can. I think we need our friends in lots of other areas working together on how to improve these and make these better. So I would just like to take a minute and encourage you to ask questions or tell me what you're doing in your school that might work well for other people. I really kind of wanted this to be a bit more about sharing. So if anyone has any questions or comments, I would welcome them now.
Wonderful. Thank you so much, Beth. I want to remind everyone that they can submit their questions via the question box. We do have a few minutes for questions now. The first one says that you mentioned that fellow faculty often incorporate public health into their courses. Do they recognize that they are incorporating public health, and do they call it public health with their students?
Many of them do, and many of them are, although I so regret the fact that the public health major and minor will be going away at my school. I am so happy that we had it because I feel like so many more faculty recognize, oh wow, I'm a biologist, I'm a microbiologist. Turns out I teach a lot of epidemiology. Wow, that is public health, because I looked through the curriculum guide and saw that it was in there, and wow, maybe I never thought about that before. So I teach at a very small liberal arts university, and I do think that people are more aware of kind of what is public health now, and I'm very grateful for that.
Wonderful. The next question asks, when did these unique course titles start appearing, and has there been an associated increase in interest from students in public health as a result?
Short answers are yes and yes. The catchy titles are especially important for our freshman first-year seminar. Students get a big long list of those when they register to come here and they start thinking about classes. So they rank them from 1 to 3, I think, their top 3 choices. And then our poor registrar has to try and put people into all those various slots. But typically the catchier the title, the more likely you are to have your section fill first. And that's kind of a nice feeling for faculty. As the curriculum progresses, yes, catchy titles are still important, but I found that a lot of students in my Capstone class, for example, schedule it because it fits their schedule. So they don't have any major classes, no internships, it doesn't interfere with their work schedule. Or they're taking it with a friend who says, wow, this sounds interesting, take it with me, and they shrug and say, okay, sure, why not? Or they've heard about different professors, and so, you know, so-and-so has a really engaging style, or, you know, so-and-so is really easy. So we still have a lot of that. And yes, absolutely, people are more interested in public health as a result of some of these classes. And I have had many students who didn't major or minor in public health who took my class as juniors or seniors and decided to go on to get their MPH. So I absolutely love that and can't wait to see them contribute to our career field in the future.
Wonderful. That's wonderful to hear. And then it looks like one more question. How do you promote the public health related courses to students across campus?
That is a wonderful question. We have an email list, and so we can sort of make people aware of different courses, and you can insert your catchy title and a little blurb about it, and it gets sent in an email blast to all of the students across campus. I find word of mouth is also really important. We only have about 1,400 undergraduates here, and so the best way in some respects is to have our PBH 101 class just completely rock it out and have those students go back and talk to their roommates or people on their sports teams or in their sororities or fraternities and say, wow, I really like this Public Health 101 class. You know, you should consider taking it as an elective sometime. And that really works better on our campus than anything else. We've got, you know, you can do the flyers and things like that, but I typically tend to rely a lot on word of mouth and also our public health club. We tend to have a very involved public health club president, and so in the past they have really talked up the classes, and that's made a big difference too.
Wonderful. Well, thank you so much, Beth, for your time today and for your presentation.
Thank you.
All right, I'm going to turn it over next to our next presenter, Keri Griffin. Keri, you have the controls.
Okay, thank you, Sarah. I'm delighted to share information this afternoon about the creation, implementation, and evaluation of our inaugural undergraduate summer public health immersion program here at MCPHS University. My comments this afternoon will cover a brief history of MCPHS University and its diversification of programmatic offerings, including the addition of the Bachelor of Science in Public Health program, benefits of early exposure to the discipline of public health, the reasons why we were interested in developing a summer immersion program, and some of the lessons learned from our first experience. So I'll begin with sharing a bit about MCPHS University. Though we underwent a name change in 2013 from Massachusetts College of Pharmacy and Health Sciences to become MCPHS University, the institution has been around for about 200 years. For the majority of this time, the university was exclusively dedicated to training pharmacists. The size and scope were later expanded to incorporate other disciplines, including nursing, pharmacy, physical and occupational therapies, and physician assistant studies. The graduate and undergraduate public health programs were added 5 years ago, and most recently, the institution has acquired the New England School of Acupuncture. The undergraduate public health program resides within the School of Arts and Sciences, which houses 5 other academic majors, including chemistry, health psychology, biology, health sciences, and a pre-medical major. Some of these programs also have graduate components. This location in the School of Arts and Sciences provides a nice fit to underscore the interdisciplinary nature of the discipline of public health, as the school is also the academic home of ethics, history, literature, communications, and anthropology faculty. This interdisciplinary setting provided support for our summer immersion program, and I'll speak to that in a bit, in a couple of moments. So a little more information about the Bachelor of Science in Public Health program and the requirements. They're actually quite stringent and require completion of 124 semester hours, including a full year of the chemistry and biology classes completed by our chemistry, biology, and pharmacy majors. In addition, our students receive instruction with at least 1 semester of each of the 5 core public health disciplines. Included in their curriculum are also additional required courses in ethics, cultural anthropology, health promotion, interpersonal communication, and a course on the evolution of the health professions. Students are additionally required to complete a field placement with a public health agency and participate in a capstone, wherein they actually undertake their own independent study. Students are required to complete the processes of literature review, assessment creation, completion of an NIH Protection of Human Subjects training, application to our institutional IRB, and upon approval, data collection, analysis with SPSS, which all undergraduate public health majors learn, and presentation of their material. Some of our students have presented their undergraduate capstone work on the national level. The rich mixture of these courses, especially focused on skill development, has contributed to alumni self-evaluation, indicating they believe they have received a very well-rounded education that has prepared them to tackle challenges in the work environment. In addition, a large number of students who completed public health minors go on to enroll in MPH programs, both here at our institution and around the country. This appreciation for learner-centered and skills-based training has also led to a relatively large number of internal transfers from other academic programs here at our institution, who perhaps completed a public health course as a general elective. The fact that we were experiencing so many internal transfers contributed to the desire to reach students earlier, as many indicated that they had never previously heard about the discipline or the ability to adopt a major at the baccalaureate level. The growth we are experiencing at our institution closely mirrors that which was demonstrated in a recent study commissioned by ASPPH and the de Beaumont Foundation. The study found that between 1992 and 2012, there was a 750% growth in baccalaureate public health, making it the 9th fastest growing mid-sized undergraduate major, and simultaneously introducing a wider variety of both gender and racial and ethnic diversity in the student population. So much growth was being experienced that a national network was created to assist in opportunities for collaboration, information exchange, and development of best practices for undergraduate public health programs. Here at MCPHS University, we were also interested in ways that we could meet the needs of the growing number of students interested in studying public health and simultaneously introduce the discipline to younger students who might not have realized the opportunity existed. This was the primary impetus for the creation of the Summer Public Health Immersion Program and extending the invitation to rising high school juniors and seniors to travel to Boston and spend 3 days with us learning about public health. We especially desired to showcase the public health interdisciplinary nature. We hypothesized that if students had an opportunity to discover the breadth of the discipline, they would be interested in learning more. We also knew that it was important to discuss the impact of SES on health and healthcare outcomes, as the literature are very clear on how people experiencing low SES have higher mortality rates, receive less preventive care, are diagnosed later in the disease state, and routinely receive less aggressive treatment. We also wanted to emphasize the need for team-based problem solving and encourage students to think about their role in advancing the future of public health. The first day of the immersion featured a broad overview of the discipline, discussed how universal the field actually is, and how frequently students interact with public health even though they might have been previously unaware. A speaker from the CDC was invited to give her opening plenary and share information about her career path. Students spent time in the laboratory culturing bacteria and discussing disease spread, and they heard from some of our current students and program alumni regarding their experiences. Day one concluded with a strengths inventory and a fun teamwork exercise. The second day of the immersion was dedicated to lessons on the impact of poverty on health. Students participated in a poverty simulation designed to provoke thoughtful considerations of the challenges faced by individuals living in poverty. The day concluded with an environmental neighborhood assessment and both small and large group debriefing sessions. The third and final day of the immersion provided the students with some autonomy as they selected breakout sessions of individual interest. We tried to creatively name sessions to provoke curiosity and encourage interest in a wide range of public health focal areas. 4 of the 8 titles are listed here. Each session was comprised of a short lecture and a hands-on activity. Students then participated in a minute mentoring session and then received certificates of completion and information about enrolling in the BSPH program during our closing plenary session. This inaugural immersion was quite an undertaking. We received 130 applications and enrolled in nearly 100 rising junior and senior participants from 60 unique high schools across 7 states. We involved 10 unique academic and professional units from around the institution, and we were able to deliver pre- and post-immersion assessments with high completion rates. To date, we have received over 60 applications for matriculation for fall enrollment at our university from program participants. There were many strengths of the immersion, and I'll share a couple of them with you. First, the program very closely mirrored in a lot of ways the discipline of public health, and that was on full display as faculty and staff from our institution and 10 different academic and professional units presented information. Faculty were public health, but also nursing, biologists, librarians, health psychologists, historians, and business professionals, and they all discussed the intersection of their discipline with the field of public health. Therefore, students had access to a wide diversity of study, and opportunities to collect data were invaluable. Through the generosity of the Dean of the School of Arts and Sciences, our admissions team, and our provost, we were able to offer the program free of charge to program participants. This enabled students from underrepresented school districts to also attend the program. Our current students and alumni really shone as program advocates, and they shared wonderful information from a student perspective about the BSPH program. And even though we covered some pretty emotionally difficult subject matter, our counseling department served as a fantastic partner in providing resources for students to consult in their own communities for additional discussion after the conclusion of the immersion. Lastly, the immersion served as a conduit for general university enrollment, and discussions are now taking place regarding the possibility of immersions focusing on other areas of study. So I'll also share a bit about some of the weaknesses and solutions that we have found to creatively deal with some of the issues that needed to be addressed. So our admissions gracious in lending their support and mechanisms for accepting applications. all careers combined. We'll also share information about our dual degree program offerings, including there are some titles that I have listed on the slide. I can't see the slide, but there are a couple of dual degree offerings that we have, including a 3+2 baccalaureate and Master of Public Health degree. We have a 3+2 Bachelor of Public Health, Master of Occupational Therapy, so we'll be spending more time talking about those programs. And finally, we'll continue to emphasize the breadth and relevance of the discipline and underscore that public health programs have the capacity to create meaningful experiential learning opportunities even at the undergraduate level. So thank you again for attending, and I'll look forward to more discussion.
Okay.
Okay, we're going to go ahead and move forward with our presentation. We're very pleased to share with you today our experiences creating career communities within the IU School of Public Health and how those career communities shifted the focus of our on-campus recruitment practices. The Indiana University School of Public Health experienced a period of change and growth as part of our accreditation process. During that time, we formed new academic departments to expand upon our existing programs. In addition to advanced degrees across 5 departments, our school is also home to a large undergraduate student population. To give you an idea of the size of our school, Indiana University School of Public Health belongs to a unique group of peer institutions, having a total enrollment of over 2,500 students. For IU, our undergraduate enrollment represents about 85% of the student population. From a career services perspective, the large size and diversity of our programs creates a unique challenge to ensure that all students are provided with recruitment opportunities tailored to their specific needs. So who are we? Here's some additional background information about our school. We are the 3rd largest school on a campus of over 40,000 students. IU uses a decentralized model for career services, where each school on campus provides comprehensive career services for its students. We have 2,700 students in the School of Public Health across 5 departments. These departments include Applied Health Science, Environmental Health, Epidemiology and Biostatistics, Kinesiology, and Recreation, Park, and Tourism Studies. We offer 20 undergraduate majors, 25 master's programs, and 5 doctoral degrees. These academic programs align with a variety of industry areas and employment sectors. Within our school, we have one career center serving all students and alumni, regardless of degree level or department. The purpose of our presentation today is to share with you the process that we went through to enhance our delivery of career services and on-campus recruitment. Our goals were to create a customized approach to career planning and recruitment strategies, to simplify the hiring process for both students as well as employers, and to increase alumni engagement in meaningful ways. There are two key steps to achieving these goals. First, we created career communities as a way of grouping our academic programs. And then we redesigned our career fair structure to align with these career communities. So what are career communities? They are not defined by departments or majors, but rather they are defined by career fields and industry areas. As such, they represent broad categories that cut across academic and career interests. The career communities develop a sense of belonging among students, create better connections between students and employers, and provide a conduit to involve alumni as leaders. We examined our career outcomes data for our recent graduates to understand hiring trends. We spoke with employers to better understand their hiring needs and the top skills they are seeking. We reached out to faculty to learn more about their curricular goals and trends they are seeing with academic internships. We also meet twice a year with our Career Services Advisory Board, and we got feedback from our community partners and alumni. Based on all of this information, we developed 5 career communities within our school. These are the career communities that we developed: public health and safety, fitness and wellness, hospitality, tourism and recreation, sport and business, and youth and social services. However, your career communities may differ considerably depending upon the academic programs offered and the employer needs at your university. A benefit of the career community approach is the ability to create communities based for your specific institution. Next, my colleague Sarah Cady will talk about the positive impact that career communities had on our career fair structure. Sarah?
Yes, thank you, Susan. So prior to establishing these communities, we hosted 3 large-scale traditional career fairs with a wide variety of student backgrounds, employers, and opportunities available. While this was great to have a large number of people in the same space, we did receive feedback from a number of students and employers that it was difficult to meet specific individual needs in this large-scale format. Based on our community career structure, it became apparent that we needed to model our career fairs to parallel the career communities. This led us towards a more focused approach to our career fairs, creating our new Focus Fair series. This focused approach allowed us to create a specialized career fair environment that gives employers and students the chance to connect and network with individuals specific to their career community. An additional benefit of this approach has been the increased engagement of alumni through panels and through networking. We look to our alumni as community leaders to guide up-and-coming professionals. Following our large traditional career fair, we dove right into year 1 with the pilot program to test the effectiveness of our new Focus Fair series. We scaled back the overall size of the events and added an interactive networking component that builds a sense of community. By inviting our alumni back to campus as mentors, we offered a space for students to learn from their community leaders. So what did year 1 look like? Based on the career communities developed, we offered 5 focus fairs over the course of the 2015-16 academic year. These boutique-style fairs provided a smaller and less intimidating space for students to network and engage with employers. To put it in perspective, our Fall Career Expo generally sees attendance of approximately 800 students. Another benefit of this focus series is to allow us to scale the size of the event based on the career community and on the employer demand. We surveyed both students and employers to obtain their feedback on the effectiveness of this approach. Out of the 39% of students who completed our exit survey, 97% of them said they were satisfied with the Focus Fair format, and 96% would attend another Focus Fair. Here's what students had to say about the Focus Fair series. "107 employers participated in the pilot year of the Focus series. The Career Expo in the fall hosts approximately 85 employers. And as you can see, the employer participation was on par with the size of each career community. Out of the 48% of employers who responded to our post-event survey, 82% said they were satisfied with the Focus Fair format, and 98% would attend another Focus Fair. Here is some feedback from our employers. "I love that this fair has become a focus event. Less quantity of students coming in, but higher quality." We love to see feedback such as that. Based on year one assessment and evaluation, we offered 4 focus fairs this past academic year by combining 2 based on the level of crossover between those career communities and the event size. We also added panel sessions to increase alumni engagement even more and add another learning element for students. Upon reviewing our year 2 outcomes, we saw the total number of student attendance remain stable while alumni engagement increased by 25%, which resulted in an increase of networking opportunities for students. Additionally, we saw an increase of 93% in employer new business development and 13% in relationship management. And now Susan will discuss program evaluation.
Within our program evaluation, we took the time to reflect on successes and challenges that were part of this process. For the sake of organization of our talk today, we will first look at successes and challenges related to career communities and then look at the outcomes of our Focus Fair structure. We experienced several successes associated with our career communities. This approach gave students a more personalized experience when accessing our resources and helped them to locate content specific to their interests. It also created industry-specific labels that were easier for our recruiters to understand. This new approach required us to rethink our marketing and communication strategies. We had to base our messaging around career communities rather than majors or departments. We met this challenge by redesigning our website and using unique emails and newsletters to tag content by career community. As we continue to refine our communication processes within our career communities, this will lead to even more opportunities to create a sense of belonging among students. We've begun this process using student blogs as well as strategic marketing.
This new Focus Fair structure allowed students and employers to create stronger connections. Students felt that the Focus Fair provided a less intimidating environment, and overall, our alumni engagement increased. It was an adjustment to shift gears and understand that the size of one fair may differ from the next based on recruitment trends and student populations. This provided us an opportunity to make changes for year 2 and to provide realistic expectations for our stakeholders. Personality and tone varies from one fair to the next, even though each event has the same setup. This proved beneficial for all parties involved because we were putting the right people in front of the right people, providing us the opportunity to enhance our employer relations efforts.
To conclude, we will provide a brief summary and share some ideas on how to apply this concept at your institution. On a large campus in a school with diverse academic offerings and recruitment areas, the use of career communities and customized career fair events around those communities can help to personalize the recruitment experience for students, alumni, and employers involved. It fosters deeper conversations and a less intimidating setting for students attending fairs. The focus fair concept places an emphasis on quality over quantity, as well as specificity of interaction. This approach can be customized and repeated across different career communities, as well as scaled to fit the size of each community. And you can tailor this approach to fit the specific needs of your institution based on your academic programs and industry areas. This particular model can be applied to undergraduate as well as graduate level programs.
Here are some action steps you may want to take as a starting point if you are considering this approach. Review your school structure and consult with various stakeholders, including employers, community partners, alumni, faculty, students, and administrators. Then begin to define what your career communities will look like. Carefully determine the number of career communities and focus fairs that would be appropriate for your institution, and continue to consult with faculty along the way to make sure the communities you are developing are aligned with your school's programs, and be willing to adapt as needed. Once you've consulted with key players and created your career communities, begin to develop an action plan for your career events. To keep this manageable, it's important to coordinate logistics of these events well in advance. We begin coordinating our Focus Fair series during the summer prior to the start of the academic year. This includes scheduling dates and timelines, securing venues, developing employer and alumni invitation lists, setting up online registration, creating marketing campaigns, campus outreach, and our budget. We are fortunate to have full-time staff, but also enlist the services of volunteers. These volunteers assist in promoting as well as event day activities. Involving others in the process will make them more aware of your programs and services, which in turn will help the program grow.
Thank you so much. We're happy to answer any questions that you might have. You can also feel free to reach out to us via email after the webinar presentation if you have additional questions.
Thank you, Keri, and then also Susan and Sarah for your wonderful presentation. There was a slight systematic glitch in there, so I apologize if we didn't get to the questions following Keri's presentation, but we will address all questions now. As a reminder, you can submit them through the question box. So the first question, I think this is for Susan and Sarah. How many faculty, staff, and employers did you survey when designing your community career communities?
So we actually utilized a process through our Career Services Advisory Board, which has on it faculty, staff, alumni, employers, as well as students. So that was a great sounding board for us. We meet with the Career Services Advisory Board once per semester. So that's a great way to consistently get information that can feed into the career communities. The other thing that we did is we based it off of information that we were getting from our career outcome survey in terms of where students were actually ending up, and looking at that related to the employers that were recruiting on campus. It was important to us to utilize those trends and create the career communities around that, rather than specifically around the existing academic departments. And although there's certainly crossover between the academic departments and the career communities that we see, we find that the career communities that we were able to develop seem to be the best match for recruiting purposes.
Wonderful, thank you. The next question, I believe, is for Keri. Question is, could you discuss the methods you use to recruit faculty and staff from other areas of the university to participate in the immersion?
Sure. So besides the fact that we are a teaching institution and we have wonderful faculty and staff who really love to teach and interact with students, the Provost's office also has very generous opportunities for many institutional grants. So small sums of money that you can apply for if you have a project that involves IP or interprofessional education projects. So it's part of the effort to try to capitalize on the fact that we have such a multidisciplinary faculty around at our institution. and to try to break down some of those silos that exist that separate different areas of study. And so part of it is also we really want to capitalize on this idea that interprofessional education does not have to wait until professional years of some of our clinical programs, and that we can really start to work on the idea of combining disciplines and using strengths from different areas as early as the undergraduate years.
Wonderful, thank you. And then the next couple questions are also for you. I'll combine them. How were the high school students made aware of the availability of the program, and were there any scholarships given for travel to or lodging for students during the program?
Right, so there were no scholarships given for lodging or travel, and so we actually limited inclusion of the students who were accepted to kind of the region. So we had applications from as far away as California, but for this inaugural immersion, we didn't accept the students who would have had to travel that far. So we did not do any scholarships for the travel or the accommodations. We are having discussions right now about whether or not it would be useful to perhaps have evening accommodations where our students could stay in the dorms. That would involve an entirely different level of involvement. We haven't quite gotten to that point, but it's kind of in discussions right now. As far as making students aware, as I mentioned, we have a wonderful admissions team. When they would meet with guidance counselors, they would mention the fact that the program existed. I have been asked on numerous occasions to travel to high schools and talk about public health opportunities. I'm frequently invited to their STEM or STEAM days, and so I would always use that as an opportunity to talk about some of the programs that we offered at our institution. And so I would fold in information about the availability of this program as well. A lot of it also was word of mouth. And so if we had a current student who was involved in public health coursework, we'd mention it, and they would talk with their friends who were still in high school. So a lot of it was word of mouth, a combination of working with admissions, and then my visits to area high schools.
Great, thank you. The next question is for Susan and Sarah. It seems like quite a large, though valuable undertaking for this project. In an office of 1 or 2 staff, what would be your suggestions for trying this approach?
Yes, that's a great question. I think the main thing is to start small the first year to see how the process goes, and definitely enlist the help of volunteers, be it faculty, additional staff, academic advisors, student organizations, and a lot of advanced planning.
Right. Yes, always planning. How did the shift to career communities and additional fairs impact your budget?
That's a great question. Each of our career focus fairs, we estimated approximately $1,000 per fair to put those on. However, we do serve food at each of those events since we have a networking area where students, alumni, and employers can interact. You certainly could defray the cost of the program if you changed your fare structure or if you didn't provide catering at that event. However, we've found that that is a very valuable component because one of the benefits of the smaller focus fairs is that students really do tend to stay longer, and they grow stronger relationships with both those alumni and employers through the additional time that they're there. The other way that we help to manage costs on the fairs is that we do charge a small fee for for-profit organizations to attend. However, the events are free of charge for nonprofits as well as government organizations.
Wonderful, thank you. Unfortunately, our time is coming to a close, but I want to say thank you to our presenters today, Beth, Keri, Susan, and Sarah. I want to remind all the participants that this webinar has been recorded and it will be available on the event page in the near future. You will receive an email indicating when it is posted, and the handout of the PowerPoint slides, which will include all of the contact information for each of our speakers is available in the handout section of this webinar and will also be posted on the website. I want to remind all that we have several other webinars coming up in the near future, so please take the time to register for those. And thanks again to our presenters today. Have a wonderful rest of your afternoon.